Hi, guys, we're coming back with another powerful episode. People have been waiting for this episode. We've got Sister Ntombi, guys, a visionary woman behind a practice that provides comprehensive services in one room. Guys, we have Sister Ntombi today. I'm so happy to have her today. And then my name is Maureen. I am the CEO of Exclusive Medical Agency. I am the director of NBS. And most importantly, I am a nurse by profession. Sister Ntombi, how are you?
I'm good, Maureen. I'm honored to be here.
Yeah.
It's thrill for me to be here.
Yeah.
Marvel.
I'm telling you, we
Just
have
the name NBS resonates with the nurse.
Nurse Business Solution.
What more do you want?
Empowering nurses, uplifting nurses, opening the opportunities for nurses. Guys, you don't want to miss this one. Sit right there where you are. Sit right there where you are. Nurses and don't be.
Yeah, no, it's about to be lit. It's about
Today
trust me.
is not only about Maureen and Sister Ntombi.
Okay.
It's about nurses.
Yeah.
It's about empowerment. It's about enlargement. It's about induction. It's about collaborative.
Well,
We are not collaborating if we are not competing.
yeah. Well, for those who don't know, I thought today I've got a guest, but hey, I think she is hosting the show today.
I mean, the conversation we've been having, I'm like, you guys are not aware what you're about to get
Yeah.
right now. Sister Ntombi is on fire.
Yeah.
And trust me, you're gonna love this.
Yeah.
You're gonna love this.
Okay, Sister Ntombi, you have met Kay, right?
I have
Definitely.
Kay.
Yeah, Kay
Yes.
is our co-host. He has been supporting us throughout from the time we started. So tell us about you, girl. How do you feel podcasting the nursing space? What's happening?
Sister Maureen, let me say this. Sister Ntombi is a nurse. You know, behind.
Sorry, do we call us sisters even in the podcast?
Why
Or
not?
sisters is always hospital?
Yes.
It is not only the profession, it's your identity.
Definitely.
You are a brand.
Yeah.
You carry the brand with
Definitely.
you wear the brand, you grace the brand. That is very important. We need to have a solution, guys, between brand identity and brand diversity. Okay, that is a story for another day.
Okay.
I told you guys.
It's already on fire.
But the most important thing, let me introduce Ntombi to the world.
Yes.
Ntombi is a professional nurse who is also a wound care specialist, trained, certified, and skilled.
Yes.
I'm also a serial entrepreneur with Elegance Aesthetics under the
Yeah.
What is Elegance Aesthetics? Elegance Aesthetics is a hub where we provide services to everybody, not only women.
Okay.
We provide perfumes, which we manufacture from scratch.
What?
We provide skincare range. We provide aesthetic services. Your teeth whitening, your lipolysis, your ultrasonic cavitation. Who doesn't want to look good?
Exactly.
Who doesn't want to wear less?
And I noticed your teeth
Where do we get the
are amazing. Like now I gotta cover my teeth.
the smile must be pure.
Don't make me like
Before you listen to my story, you're going to see me. Before you hear,
You are your own marketing.
before you listen to me, you need to see me. So that is very important.
Sure.
And who is Sister Ntombi?
Yeah.
Sister Ntombi is a wound care specialist who owns 3 clinics in Mabopane,
Yeah.
which services more communities. Hammanskraal, Soshanguve, Mabopane, you are secured. Madidi, you are secured.
Madidi as well.
Madidi.
Okay. All right.
You've got a clinic in Lechabile, which services the likes of Jericho, Mabuluka, Mwileswane. You've got a clinic in Brits as well, which covers the whole of Madiben region. Why does E&M Healthcare, which is a specialized wound care clinic, chose to do those specialized services in location, Kokas?
Wait.
I mean, that's
E&M.
wonderful.
E&M.
E&M. What does
It's a
E&M stand for?
specialized. E&M actually is an acronym. Embelintobizotwa Mudibedi.
Oh, wow.
Remember when we start,
Oh.
because
So E&M
NBS
is actually the umbrella.
The umbrella.
Okay.
Remember when we started, NBS was not there for the likes of us.
Exactly.
Luckily for those of you who are coming on board, NBS solution is here for you.
That's what talking about that, right? We see a lot of nurses relaxed in their profession, right? And you're talking about being a serial entrepreneur. I'm not talking about a nurse starting a business just to start one business. No, you're saying serial entrepreneur.
Serial
You've got a whole lot of products here. And I am asking myself right now, like, what inspired you to even start this business?
Yeah.
Okay, this is
And also,
simple.
let me just push it further. The background of nursing, how did it influence you to go into, this?
Okay, you have to ask yourself, what is your purpose? If you haven't changed somebody's life,
Yeah.
then your cycle is not complete.
Okay. Okay.
Are you running a business or are you a purpose-driven business? That is very important.
True.
After you've qualified as a professional nurse, you are now tired. You've hit the ceiling academically in the hospital setting, and you feel that I don't want to do this anymore. We need to be inspired to aspire.
That's true.
How do I diversify myself into growing? With me is beauty and health and wellness.
And you look
That's-
beautiful.
Thank
Exactly.
you.
She looks so
I
stylish.
represent because without wealth, there's no health.
Yeah.
Without health, there's no wealth.
Mm.
The nursing background actually worked in my favor. If you come to my studio for aesthetic services,
Mm.
I already know the diabetic signs. I already know that I have to monitor your vital signs.
So the assessment.
The assessment itself
actually-
is life-saving. There is interlace and communication between aesthetics and wellness and health.
Mm.
Therefore, it's a ground barrier.
Wow.
And the two communicates. You can come for aesthetic services. Meanwhile, you've got a medical problem.
Mm.
Okay.
So you're sorted.
Ooh. So it's like the umbrella covers everything.
Yes, she is given what we call holistic, complete medical services. That's what she's doing. From a nurse,
From a
not the
nurse.
doctor.
Mm.
I'm not talking about doctor.
So normally it's
You know, like
doctors who do that.
People are like it. I don't even know one doctor who does that. Let's start there. I don't even know one doctor who's doing what she's doing.
Mm.
I mean, even me. I've started my company 3 years ago.
Mm.
I'm already doing about not three. Let me just say about 4 or 5 services in one umbrella.
Mm.
But what she's doing,
Mm.
no.
It's wonderful, right?
Where do you get balance? Okay, before balance, I want you to actually point out all your services for the viewers. What are your services?
Yes, when we say serial
Yes.
Let's break this down to make it make sense.
Yes.
We're making academics fashionable.
Yes.
We're making nursing fashionable.
Yes.
You are trained as a nurse. But how can you now diversify into business?
Yes.
We are a specialized wound care services. Your diabetic food, your open wounds, you've got what we call kasetswana sefula.
We're going to come to
Sefula.
there.
And we're losing a lot of young people with regards to that. Amputations that are not necessarily because misdiagnosis and late treatments. Delayed treatment can lead to
Delaying
amputations.
treatment.
But wait, Manessa, for this is full amos.
Who said that? Okay, I break it down. I break it down. Let's break it down. What is sefula? Sefula is a generalized term in African way. Let it be put it that way.
Yes.
But you've got a mixed ulcer, you've got an arterial ulcer, you've got a venous ulcer,
venous ulcer.
you've got a diabetic ulcer.
Yes.
There are different types of lower leg ulcers. But now, if we say sefula, you are taking a common name and all of this, which are not even diagnosed. What is your blood glucose level? What is your What is your cardiovascular history? Are you hypertensive? How does it communicate with your lower leg?
How is your blood flow?
Are you compromised already? Do you have past injuries? Those are the things that drove me to open clinics that are specialized in ligation.
Yes.
Let's say
Those are the use questions.
that patient is also valuable. That old woman is also valuable to get the specialized treatment. The aim is to educate our communities. Wound care is reachable. Wound care is accessible. It is a specialized unit that can save a lot of limbs, that can restore hope. How do you go to work if you've got a leg that's leaking?
Definitely.
People have lost their employment opportunities because they cannot work. I mean, you are 38 years old, Maureen. You are a breadwinner.
Guys, I want to cry right now. She's just triggering the things that I didn't want to open.
You understand?
I'm telling you.
There are people who lose their jobs because they can.
I've got a patient. I've got a patient.
Sister Ntombi, what are you doing? Mr. Makeup artist. Don't
That is the aim. That
Ntombi,
is the aim.
what services do you provide? Let's go back.
Okay. Okay. I see.
Remember, ENM Healthcare is a comprehensive clinic from primary healthcare, your circumcision, your specialized wound care, your family planning. Guys, you can come and check your blood.
Okay.
You can come and do your PIC. You can come with for your well baby, your mother. We
Okay.
also
Okay.
yes, we are a specialized services in wound care, but we also do provide primary healthcare service.
Okay.
And we don't end there.
Okay.
We also do employee wellness. Remember, I'm also occupationally trained.
Yes.
Why not? Employee wellness is very important.
Okay.
I can give you a sick note, but I need to get you back on the field.
Yes. Yes.
Need you two to go back and work.
Wow.
Workforce
So
is
you can,
important.
if you can issue out a sick note.
We can give you a sick note. We don't sell sick notes. You need to come and consult in a
Yes.
proper way
Yes.
so that we can assist you.
Yes. Yes. So many services
So many services
rendered by
us.
a professional nurse.
Professionalness, the power of nursing. And also collaborating with
That's
other health facilities.
Yet I'll sit
People.
here and I said, Sister Ntombi, you're making me emotional.
And you
You
are
don't know
saying,
how people are struggling. You don't know how many doctors
No.
are not working right now.
this is
You don't
very
know how
easy.
many doctors have knocked into my space to want to just do a drip.
A drip
Morino
system.
Tampatela just for a drip.
Morini, will you
Where
please-
are you for all the doctors? I'm no longer talking about nurses only. I want doctors. I want doctors to come through. Okay,
we want
we're
care
going
wo-
broad.
we want care workers.
We want care workers.
We want care
True.
workers. We want the staff nurse to say, you can open your own aesthetic bar. This is what we call skill transfer, occupational skills. You're going to work with your hands. Yes, there are legal parameters we have to follow
Yes,
for you to be able
yes.
to put
We
up
will
a
guide
drip.
you through that.
We will guide you
NBS,
through
So
that.
NBS
yeah.
coverage?
NBS is here.
Exactly.
NBS is here to cover that and make sure that the practice is safe, the practice is legit. You just need to avail yourself and have the tenacity. The aim is to empower
Yeah.
healthcare workers to say, we can do this. I mean, the pie is big.
If we finish the pie,
We
what
buy
do we
the
do?
pizza.
Thank you.
Exactly.
We buy the pizza.
Wow.
And-
Okay. Thank you. Now that we have actually laid out your services, I'm very happy because you've missed one thing that I saw on your profile.
Yes,
Circumcision.
we do circumcise.
No ways.
We do
Tell
circumcise.
us.
Nurses are,
Because we know the doctors taking the
nurses
patients
are
to
trained.
theater.
Nurses are trained, nurses are skilled, nurses are legally permitted, if you're trained and skilled, to do circumcision, which we do,
Okay.
and it's safe.
Mina, I thought it's only the chiefs at the rural areas whom will take the Bahanababa to the circumcision, and those people are not even medically orientated.
And guess what?
And they
That's
said
true.
they
That's
do how many? How many? Ba re
so
ke di initiate ba re ba ba bitsang bana ba
dikoma.
dikoma ba bua e le 100 o kry motho ba bua le save and sell ba fodile.
That's why
Wow.
we collaborate with them. More, we cannot say we cannot do without
Collaborating with them.
tradition. We cannot say we cannot do with tradition. How do you
Yes,
go forward
yes,
if you're
yes.
losing your background?
Yeah.
Sure.
How do you move forward if you're losing your identity? Rather collaborate with them in a manner that we avoid sepsis, we avoid frostbite, we avoid amputations, we avoid blood loss. Be available
Blood
more
clots.
as a wound care specialist to say, I am your backup. Kindly call me and say, sister, how do you think? Why do you look at this
We're
wound?
going
What
to
do you
offer a
think?"
group. I want to say it
Is
here.
that an ongoing thing?
It is an ongoing thing
Now-
where we invite the traditional healers
Oh.
into knowing the signs and symptoms of infections.
Oh.
How do we eliminate this? How
No,
do we
Sister, we had that kind of a program
Yes.
set up.
Yes, how do we approach circumcisions traditionally but aseptically?
Oh. Okay.
I mean, they're killing the game. They are circumcising boys.
Mm.
We cannot shun away from this.
Yes.
But how do we avoid complications?
yes.
That's
How
advanced.
do we make
That's
sure
good.
that
How
they
do we
are able to
manage?
identify?
Yes.
Because we can't stop the
This is part
No,
of us.
it has been the
No.
culture.
This is
Yeah.
part of us who we are. But how do we integrate
Mm.
into a safe
That's true. True.
by virtue of telling them, can you sterilize your instruments?
Mm.
Can I just show you how do you instrumentation?
Mm.
How safe?
Can I show you
How you calculate blood loss?
True.
How do you observe
Mhm.
the signs that we are losing the boy as
Wow.
early as possible? And what can we do about it?
Mm.
Identification is another thing.
Yes.
But what can you do about it?
Yes.
After identification, then what?
Yes.
That is
Yeah.
very important.
Let's go back to the services so that we can align them
Yeah,
properly.
I want you to please tell the viewers and everyone, where are your clinics?
Okay.
I mean, if you have multiples, where are they? Where are you situated?
Please find us on all the socials. Elegance Aesthetics, E&M Healthcare, Wound Care Clinics, personalized Ntombi Dibedi. All the information is out there, even my personal cell number. We are situated in Mabopane,
Okay.
1924 Block X.
Okay, Mabopane is 012, right?
Yeah, definitely.
012.
Shout out Pretoria.
Shout out to my people.
We also have a branch in Brits,
Okay,
23 Peanut Street.
Brits is northwest, right?
Yeah.
Brits is
definitely.
northwest, northwest
Okay.
is covered.
Mm.
We also have a clinic in Lethabile, Kokasi.
Okay.
Ka mo hara
Wait,
lekeishene.
Lethabile ke Pretoria.
Lethabile ke
Yeah,
Brits.
yeah.
Okay, it's
Mara
a,
ke
it's a
lekeishene.
northwest. Okay,
Yes, Brits
all
is
right.
in the town, Lethabile ke lekeishene.
Okay,
We've got another clinic for 1463 Block B, Soren, right on the main road.
okay.
Mm.
The aim is to make sure
So
the
your
services,
services are
accessible.
also aligned to accommodate even the ones that can afford.
Yes. We are not only seeing private patients or medical aid patients. Everybody is welcomed.
What do you mean?
No, we've got pensioners.
Yes.
Are they not supposed to get service because of money?
They are entitled for a
They are entitled
safe
to a
and healthy
safe
service. Yes.
healthy service that is specialized. We're
Yes.
speaking about specialized services
Yes.
that is accessible
Yes.
to the communities.
Yes.
How many patients have we lost that has to travel all the way from Limpopo to George Mokara for dialysis?
Oh my goodness.
Yeah.
How many clients have we lost
True.
that could have been saved? More, I don't have 500 rand for transport. How do I then pay for consultation if I have to travel so many kilometers?
Mm.
But if the clinics are accessible to the nation, it's very easy for them to come and consult.
Can they afford?
They are. The services are affordable.
So what of the patients that don't have money?
No patient is turned away because of money.
Amen.
That is a very important tool.
But
You
how do
need
you
to
make
know
a
that.
profit?
The alignment is there. You are not here for the profit, but for the purpose.
Mm.
The minute you find your purpose,
Mm.
work on that. Leave the rest. The universe pays
The rest
itself.
will follow you.
The rest will follow you.
So what about the situation that we are facing in the country where people are turned away by people with interests from clinics because of papers and stuff like that? Is that something that is like, good or bad if you
It-
look at it?
Okay, let us put it this way. Healthcare is a scarce commodity.
Mm.
The reason that we go to consult is because we are in pain.
Yes.
True.
It is not a luxury. It
Yes.
is a necessity.
Yes.
Can we leave the politics aside and look at the health?
Yes.
Is it worth it to lose a life?
Let's not
Yes.
leave the humanity
Because
part of it.
Is it important for me to lose a life that I cannot replace
Jeez.
because of
It's
political
so sad.
greeds?
It's so
It
sad.
is.
What
It
we
is
see
sad.
on the social media about that.
What does my
it's
pledge
very,
say?
very sad.
What
But
is
what
my
about
pledge say?
the other people who say that, yeah, we understand that, but what about the people who are disadvantaged by the influx, by the overworking of our nurses, the infrastructure that is being
That goes back to the parliament. Let's go and
Yes,
sit down
yes,
and look at the structures.
yes.
That is why NBS is here.
Yes.
That is why NHI is coming
Yes.
to say how can we integrate all the stakeholders, the private sector and the public health sector.
so
And we are not sitting here to say,
beautiful.
yeah, and we are not sitting here to
Mm.
say that
It is wrong.
it is wrong.
Mm.
I mean, there are some processes that needs to be followed for you to be for you to be authorized to be in South Africa.
Definitely,
Those, I think, is different. Is that part needs to be treated different
Mm.
as to someone who is sick, who's in need of a care, and is
Mm.
going to the clinic and they get pointed to say 1, 2, 3, 4, go.
Mm. Now I understand our government. They are really
we
for the
cannot
people.
shy away from that
Mm.
the system is overloaded. It's
Mm.
overburdened. But let it not overshadow our purpose.
Mm.
Our purpose is to save lives.
Understand. I understand.
What is a health facility there for?
Mm.
This is
Okay.
not something that is a
So
want.
are you
It's
saying
a
now,
need.
Sister Ntombi, we can actually go to the rural area and structure clinics?
Why not? Actually, it is needed. Nurses, please go and open clinics in villages.
Mm.
Let the patient have accessible, quality healthcare that is affordable.
Can I go a little bit deep into what you just said right now, right? When you say go to the villages and
Yes.
open a clinic, what do you mean by open a clinic? Do you mean by get an
tent?
office, a tent, a container or something?
That's why we have got NBS.
Yes.
Get a nurse, or you go there as a nurse, or
That's very simple. NBS is here for that.
So
exactly.
where are you?
Exactly.
Where are you have really forgotten your position. NBS.
NBS for me, I've got a tailored solution.
NBS.
NBS is there you covered.
Yeah.
Everything is sorted
You
for
are
you
a
in actual
trained, you
fact.
are a trained professional nurse. You inspire and aspire to be like Sister Ntombi. You want to open your own clinic. Come forth.
Yeah.
Come forth with
The,
the tailored
the
solution.
reduction of overcrowding of patients in the hospital. With nurses having to sit and they say Remechi matogo a re bereki. Guys, you've got skills. You've got skills that you can do. This NBS. We say,
Definitely.
come to us. Let us help you. Let us tool you.
Sister Marie,
Sister Ntombi, give me your hand. Give you this one. No, the other way. No, this side. High five.
wonderful.
To nurses opening
Wonderful.
clinics, they're overburdened in the system. The facility is already overloaded. If 2 more professional nurses open their own clinics,
Definitely.
You
We
talked
offloaded.
about offloading, overcrowding of patients, that nurses are overworked
Yes.
in the hospital. Then we say, NBS says to you, come, let us help you to open a clinic.
Definitely.
Reduce.
Let's talk about that, Sister Maureen, right? If a nurse is watching this, right? By the way, don't forget to subscribe. Don't forget to subscribe, like, and share.
Yeah.
And also, I always say this is very important for you to be watching this with a notepad and take notes,
Yes, take
because
notes.
your dream right now is being outlined.
Yes, yes.
We have people who are living your dream, literally, and they are telling you how they made it come into reality. So now I want us to talk to the nurse who's watching this,
Yes,
right?
yes, yes.
And we say, okay, when we say NBS is asking you to open a business, what will NBS, Sister Maureen, do to make sure that you open that business?
You just have to make up your mind. Realize your gift. Not even a gift, your skill. You understand? Go back. Go back and check on your epaulets. Remember gore o nurse. Contact us. NBS on TikTok, we are Nurse Business Solution on all social media platform. You just phone in to say, I am ready. I want to open my clinic. We will help you to start with registering your company, which is CIPC. And it's just only through the
First step.
membership. First thing. Remember, compliance is very important with us.
Definitely.
We don't want you to be working ulebeletse ka mafanstere gore who's coming, who's not coming, and ke tlo tshwarwa. We want you to do things.
And this nurse, are you telling them when they come and be part of the membership, are you telling them to say that this is what you have to do? You have to register this.
No.
Or what is the process?
We sit down and we have one-on-one discussions. That's where we will be able to identify which service do you want to take in which space, because this brought. She's doing a lot of services, you understand? So then that's where we'll align the name of we'll help you to align the name of your practice towards what you want to achieve, what you want to provide, what you want to do as a service. Understand? We start there.
Okay.
From there, it's account. We help you to open an account. And the good thing, Kay, and I'm going to repeat this, we are working with a bank.
That is beautiful.
We are working with a bank. The bank just says to me, Maureen, if you identify those that are ready and they start their structure and they say this is 1, 2, 3, 4 that we want to have in our clinic and we don't have capital.
Capital is available.
So I want to mpotjang gore a ke na tšhelete ya go thoma.
Jeez.
That is a marvel.
And by the way, you
That
must
is
come.
music.
Yes, tell them to come on the 8th of November. Ntombi, tell them.
Ladies, I've got a secret. On the 8th of come and listen to the stakeholder that is coming.
Yes.
I'm also there.
Yes.
I'm
She's
also
our
going to be
speaker.
there. I'm also one of the main speakers. I'll be sharing the information for you to understand that how did I start business? What are the challenges that I've...
Even those that are
How
in the
do I
business
learn?
already.
How do I learn? You've opened the clinic.
What?
You've opened the aesthetic services. You want to open your own aesthetic services. You've already opened, but it is not making profit. Let's go back to the drawing board.
Yeah.
Where did we get the loophole? There is always a gap in the market, but there's also a market in the gap.
True. True. Mm.
Thank you.
That is very important
Thank
to
you.
understand that.
And the other thing, Kay, not only that we open the company and leave you there,
Mm.
we have a capability, we have capacity
Mhm.
to help you to get your marketing structure done in terms of your business profile, your business plan, your business card. You understand? What do you want, guys? Let's do it.
So, Sister Ntombi, right, with what Sister Morin is saying, I don't know when you started your practice. We haven't dabbled into that, right? But I want to ask you this question, right? If you had NBS when you started all this, how do you think it would have like maybe assisted you?
I think she
Okay,
would have
there
been
would be
owning the
E&M
building.
healthcare in each and every province. Remember, for some of us, when we started, there was no guidance.
Mm.
The reason that I'm offering mentorship classes
Yes,
is because I
that's-
never had
I wanted
one.
to talk about that.
Mm.
The reason
yeah.
that we're doing this is because we never had a guideline.
Mm.
What is a guideline? What is a policy? What is a protocol? It is a framework to guide us how to walk this journey.
Yeah.
We started, we lost a lot of money because I didn't
Wow.
know how to do my own
And
billing.
the good thing, Kay,
Mm.
Renali, the companies that we are partnered with,
Mm.
that completes your services. By so saying, I'm saying we've got Sister Ntombi. She's got master classes.
Mm.
She holds classes for aesthetic bar.
Mm.
If you don't know how to put the drip,
Mm.
if you don't know which therapist do you have to go through, she's got those classes. She is part of NBS.
Wow.
That's where the sit and understanding each other is very important.
Yes,
Because
definitely.
then when we realize now that you want to venture into wound care, we send you to Sister Lizelle, eloquent.
Yes.
If you want to do aesthetic,
Mm-hmm.
what do you
You
want?
are sorted.
What do you want?
That is
If you
why
want
for
to do
you-
billing and coding, we are covered. If
Done.
you want to do distribution,
Everything is
we
sorted
are
for
covered. We get you a license. Okay, we're not getting you a license, but we
Yeah.
will.
Make
we will
sure you
license.
get a license. We'll guide you into getting the
Yes, because compliance is
Yes,
very important.
definitely.
So all channels. Now we've got Coloplast. They are sourcing out nurses, looking out. Guys, it's just that we are in a professional profession.
Mm.
Did I say that right? We are in a very professional profession. That's
Oh,
what I want to
yes.
say.
Mm.
Where we can take boards and go to the robots and say, nurses who need to work in the Coloplast, please, no, we can't do that. Reach out to NBS, guys. Opportunities
What
are.
saying there's no jobs for nurses.
Create a job.
That's true.
If you ask me what am I bringing to the table, I'll tell you I am the table.
Mm. Hmm.
I wanted aesthetic services to enhance how I look.
Mm.
Okay, how you age is your problem,
True. True.
and we can solve
Am I
it.
doing good so far?
You are looking good,
You're challenging me.
and we are capable to help you with
Yes.
that. How I look is something that I can work on.
Yes.
How do I feel is something that I can work on. That's why the word aesthetics is a broad name.
Yeah.
It comprises of facial treatments, body treatments, your teeth work,
Wellness.
your LGP,
Yeah.
your general wellness.
Yes.
I mean, you ask me, I'm hyped, I'm energetic. It's because I put a jet fuel drip on myself.
Wow. What is that?
We should have
It's
talked about
vitamin
that
B,
because
it's vitamin
need
C.
one.
I need to get replenished. I am overworked. I'm a wound care specialist. I'm in and out of the hospital. I need to be replenished.
So she's so complete.
Mm.
In the simple term, she's so complete.
Mm.
I'm not complete. I am
Okay.
not complete. I've got a wound care clinic in Johannesburg, surgical, first floor,
Mm-hmm.
in the newest hospital in the country, Johannesburg Surgical, Randburg, Northcliff.
Mm-hmm.
I've got a lot of patients. I'm supporting about 30 specialists, but sometimes I would be worried after treating a wound, and there's a scar.
Oh.
It does not complete your management.
Oh.
Doesn't. What do you do about that scar? You need. That's
That's why
Oh.
you need the tissue oil.
The tissue oil.
yes.
Scar management.
Okay.
Remember, part of you as a nurse is to instill hope and
And
restoration
rehabilitation.
and rehabilitation and faith. I was injured. How do I close this big chapter if I've got a very big scar that is visible? It will affect how I feel.
True.
But where do you come in to compliment me? By help me reducing the appearance. That's why we're doing laser treatments.
You do laser
We'll
treatments?
do laser treatments to combat that.
At all clinics or?
All the branches. We remove tattoos.
Wow.
So that excuse that I cannot apply for SAPS because I've got a tattoo,
Mm.
it's a lame one. It doesn't work anymore.
Not anymore.
We remove the tattoo at a very low cost and affordable prices, especially for those SAPS candidates.
Yes.
Outside ya tšhelete ya koko, ya
Mm.
pension. We're going to help you remove that and help you
Wow.
Wow.
It's wonderful.
to do.
So
You
talking
are a
about-
complete combo, sister. I'm so proud of you, girl.
Thank you.
Definitely.
Well done. You did very well. And you're still pushing.
God said we must go and occupy. We must
Yeah.
do business until he comes back.
Yeah.
Which
How do
Proverbs
you
said he what?
balance? Tell me, how do you balance?
Ooh.
You've got a wound care clinic, you've got aesthetic bar, you're
Yeah.
doing all of these things that you have mentioned. Eh? You are a manufacturer.
I am a product manufacturer, certified by the way. I'm a skincare product formulator. I don't only
And I see
manufacture, I'm also a formulator, which means I can start a product from scratch.
You can, you have.
Everything that you see here is here, which means it's safe.
Mm. Definitely.
And you are your own example.
I am my own brand. I live the brand. I mean, the room is smelling nicely.
Mm.
No,
I mean, it
yes,
is,
of course.
You-
Definitely.
How do we integrate all of these services
I do
into
not.
one?
I want to say this, and I'm not gonna edit this. This one I'm not editing.
Mm.
I will never support a nurse who is selling products that was not manufactured by herself as a nurse.
Why not come and teach you? Why not come and learn?
Well,
Do your
sister
own-
Ntombi Aliteng, I teach her nurses to start their own manufacturing.
Start your own brand. You've got what it takes. You've got your hands.
Mm.
More, we need to know and acknowledge that we don't need only academic skills in life. We need also soft skills. Soft skills is how do you manage the business after opening it. Hard skills is what you can do. We need occupational skills. You need trade skills. You need to be a diversified entrepreneur.
Yes.
How many baskets do you have? Garden of Eden had 7 streams. How many streams of income do you have? Can somebody answer me? The Garden of Eden had 7 streams. How many streams of income do you have? In this 10, in this
You also
lifetime.
don't know. Sai, you also don't
In
know.
this lifetime. That's why you need a drip therapy
Yeah.
to augment that. We've got patients who've got low libido.
Mm.
Low libido.
Yes, we've got drips for low libido. That is very nice. Hey?
Can I
we
get that?
restore it.
I don't
No
have it,
way
but
is
just
Kelly.
to... I'm kidding.
We're restructuring lives.
Yeah.
But it's things that we need. I
Yeah.
remember-
To talk
I
about
remember-
this.
now Lee has a solution. Lee, you've got a solution. Because the first shoot, he said to me, Maureen, I want to send people for circumcision.
Yeah.
And then I want the wound care to be, I think the best person to do it now is Sister Ntombi. She's
Definitely.
That is so.
I mean, she has everything.
And we
Let's
spoke
go for the
earlier.
freedom.
Yeah.
We spoke earlier about being self-employed
Mm.
versus being a business person.
Yes, please clarify that.
We need to touch base and remember,
Mhm.
if you are self-employed,
Mm.
let me make a practical example. At
Yes.
this stage, all the clinics were functional today. Unfortunately, now they've closed. You'll be serviced as from.
So your clinics are actually, you have employed
We've
people.
got employed people who are trained, who are professional nurses, who are skilled. The business is running, it's got its own identity. I'm not self-employed, but I'm a businesswoman. Because
But
if
you're
you
a nurse.
What are you talking about?
if you are
Sister?
I
self-employed,
thought she's a nurse, so I'm
I am a professional
confused.
nurse, but I'm
No,
a businesswoman.
Yeah.
If you're self-employed, if you are away from the business, it means the business is non-functional.
Okay. If you are
If
self-employed.
you are self-employed,
Okay.
if you get sick, what happens?
You can't
The door
work.
closes.
Yeah.
There's no
But
employment.
if you're running a business, you go in to put a system that will run the
Delegate.
business, and you delegate and you employ professional people that are skilled and trained to run the business. You don't have to do everything yourself.
Because I was gonna ask her, how does she balance all of this? Because the last time I saw her on a post, she was in theater.
That's,
was
the,
something
that's
that
the power of
put in-
collaboration.
Putting an
And
Apthera.
Apthera, which is an open abdomen surgery, we leave everything open. I know, guys, this sounds a little bit shady for you, But there are clients that we need to leave everything. That's where wound care specialty comes in. You've got your gunshot wounds. We need to explore and look at the extensive damage. That's where we use advanced wound care settings where I put a VAC, which is a negative pressure wound therapy treatment. That is going
Yes.
to help you close that wound.
Mm-hmm.
Somebody
This
may
is the
ask me,
services. This is the services that I mentioned that there are wound care companies that are willing, and I'm still repeating, to train nurses for free. For free. This is
and get paid.
yeah, and get paid
Amen to that.
for free. They just call you. They call you to their space, their training rooms. They arrange food for you. They arrange time for you. They get lectures for you.
Invest.
They get stock that you're going to be practically doing that for you. And you still say, I do not know what to do.
Sister Ntombi, with what Sister Maureen just said, right? I want you to like maybe explain something that I'm always like everything that we've just mentioned, right? NBS does everything for you to a point that they even tell you, hey, if you don't have money, we can actually pitch a funding for you. You can get funding, right? If you don't know what to do, we have people that we have partnered with that can help you. Our sister, Lizelle, our
Yeah.
sister Ndombi.
Yeah.
We have
Sister
people,
Tesh.
right? Sister Tash. We have people that can actually show you how to do everything. At this point, there are, I don't know how many nurses we have in this country, right? Or in Africa, because I believe this has to be,
Africa.
continental
Yeah.
or even global.
Yeah.
I mean, I think we're global because we have nurses in America,
We've
right?
got a global nurse rights summit. That tells you a lot.
Exactly.
That actually tells you
Exactly.
a lot. That means we are
Yes.
international.
Definitely.
We're going to be having international speaker from America coming to
That is
talk about
beautiful.
Guys, we are getting someone from America to come and talk to the nurses. I want to see nurses in that wall. No nurse will tell me where they are working because we are telling you now time in advance for you to arrange and manage your day.
What about the ones who are working night shift?
Okay, the ones that are working night shifts,
Yes.
I don't know. They will miss it, but yeah, I don't know what to say.
It depends on you.
Yes.
Okay, I always tell people, all of us got 24 hours.
Mm.
But what is your priority?
Yes.
What is your priority?
You sleep 2 hours, you can still go get there.
Yes.
This is once in a lifetime opportunity. I
So
mean,
if you have
Dr. Kamonjelele will be in the hall. Amen.
Thank you.
Doctor who?
Dr. Kamonjelele.
The social media.
Doctor, that's advocating for
Yes,
nurses.
yes. He is
Shout out to
coming.
Dr. Kamu.
Yes.
Shout out, man.
Kamonjelele.
Hi, doctor. We're waiting to see
Sister
you
Ntombi
there.
will be there. And
Yeah.
you are telling me you need your 2 hours to sleep?
And beside that, Sister Ntombi, you knock off, you go to ShopRite, you go to Woolworths, you go to get that and that, you get home what time? 1 o'clock.
What is more important to you? What resonates better to you? Okay, if you don't invest in yourself, who must believe in your dream?
Amen.
My wife is not going to be happy about this.
If you don't believe in your dream, why should NBS believe in yours?
Yeah.
How much are you willing to invest in
Definitely.
yourself as a brand?
Let me stop you,
You
there.
know-
There's the question that I was going to, right? And this it's very important. I'm always like perplexed and very conflicted with understanding that there are so many nurses we have, and still, how many members do we have?
We are sitting on 20 and this is because of we wanted to trial run the process. We didn't
Yes.
want to just overtake everyone. But now we can take up to 50 because we were approached by companies.
With that being said, we are supposed to be moving to 5,000
We are moving
because of
beyond that.
everything that is being given. Why are nurses, this is the question, why are nurses reluctant or moving slow into actually, going into into business?
Doing it.
Into entrepreneurship.
Fear of unknown.
Yeah.
Fear of unknown. And I talk about
fear is equals to paralysis.
Go.
Fear equals
Oh, guys, can we have Sister Ntombi every week, guys, please?
But no, I cannot take that answer. I'm sorry. Before you continue,
nurses got
you
fear.
have everything that's fear of the unknown. You have the knowledge, the people, everything being done for you. What else do you think is holding them back?
Comfortability.
Mm.
There is a very, very statement that I hate in nursing.
Mhm.
I've put the patient in comfortable position. That's where the pressure ulcers are going to develop. Because it's a comfortable position. The sooner you get uncomfortable with being comfortable,
Move yourself.
the sooner you're going to be able to grow. No change, no growth. No growth, no change. And if the dream doesn't scare you, it's invalid. Maureen, I decided I'm in ICU. I know ICU out of my heart.
Yeah.
I can intubate a patient with closed eyes.
Yes.
I've been into corporate world. I've been into mines.
Yes.
I worked in BMW. I worked in mines because I'm an occupationally trained nurse.
Yeah.
What do I do? What is my purpose? What do I do after this? How much are you hungry?
You know,
How bad do you want this?
to think that there are people who are still comfortability. I'm going back to that point. Sitting in their positions. They don't want to move. They will rather see to means of augmenting their salary even when they see they can't.
Even when the body tells you, I cannot anymore.
When we have programs like NBS where we say we hold you by hand, we are not saying resign from your employment. No.
Okay.
We're saying while you are still there, let us help you to structure. Then when it's time for you to swap,
the question is,
You know everything.
the question is, which part in NH are you going to play? Can you stop the blaming part
Okay.
and get on the working part?
that's what I'm always saying, Sister Ntombi, that if there's a nurse, an RN, that is still sitting without a practice number, guys. If practice number, that is the first thing that will actually make you realize that you need to use it.
How do you get a practice number?
Okay, we also help with that. NBS also help with that.
Okay.
We just registered about 5 people. We're waiting for the response. And the other thing is that I'm gonna say this. I feel sometimes, Sister Ntombi, sometimes you will see me walking, and you'll feel I'm strong. Some nurses will drain you. Some people that we have in the membership will drain you, my angel, drain you out. Because nurses believe in just sitting and they want you to come and give them.
More comfortable position is dangerous. Comfortable position is
To an
dangerous.
extent that some of the members that we have, and I'm going to say this, they will be, now we're still waiting for we will send forms, please come.
How
we
many
go
doors?
to an extent of downloading the application. It's online.
So you're forcing.
How many doors
you're
have you
still
knocked
forcing.
at?
It's online.
How many doors have you knocked at? More, I say this loudly and boldly and proudly. Approach me. Not all of us want to become wound care specialists. Not all of us want to do a baby clinic. Not all of us want to do beauty. But we can assist you through mentorship.
Yes.
Why not open a farm?
Yes.
Why not go and open a medical waste facility? You are already in the vicinity, in the
Guys,
sphere.
now,
There is so many components.
you know, when we started the
True.
podcast, you know very well this, and then Lee also
I
knows.
went through the question.
You know, no, listen to this. I want to say this. I used to be so much skeptical with words. I will edit a lot of words, Sister Ntombi, to say, Lee, please edit. Eshe, my my production manager. I will ask him to edit it, because I feel like I didn't say, I made
Articulation.
not even, but I've mentioned maybe words that will trigger.
That will
profession, that will harm someone.
Yeah.
But I'm so happy, Sister Ntombi, you are here to tell
Are we that naive and comfortable with the salaries that we get?
Yes.
Or was it only me who was underpaid?
How long did you do bedside, by the way, before you went into business?
I've been a nurse from 2005. I left bedside nurse in 2017.
2005.
Yes,
How many years is that?
in ICU.
Is it for 20 years?
In ICU. Not just any ward, in ICU. Full time in ICU.
How old are you? You don't have to answer.
I'm old enough. An old one is
28?
expensive.
28.
I'm 45. What? I'm not even ashamed of my age because I defy my age. Your age is your problem. How you age is a problem with aesthetic. Let me help you.
Can we make an appointment to see Sister Ntombi?
I mean,
You'll make me stand up. You'll make me challenge you and stand up.
wow.
Okay, your health,
Are
your
you from
health,
South Africa?
your health is your wealth. Your health is your wealth.
I'm so,
And we as nurses,
I'm so
shift
inspired.
work,
I'm so
especially
motivated by
shift workers, that's why we miss the plot. we don't eat properly, we don't hydrate properly, we don't take care of our wealth.
Yes.
And the nurse is the last person to go and consult, by the way.
That's
A
true.
nurse.
Mm.
If you go and consult as a nurse, we know that you are rare sick.
It's-
Oh, sister wakula. Because what do? We self-medicate.
True.
But when is it about you? When are you going to put up a drip, hydrate you, to replenish you?
Mm.
As much as we replenish the body,
Mm-hmm.
what's happening to me, my worth, my growth?
Mm.
I've worked in ICU for 12 years. Do I still feel relevant to the market?
Mm.
Do I still feel that I'm needed? Do I still feel appreciated with the new nurses that are coming? IA is here. Fourth industrial revolution is here. We cannot deny that.
Yeah.
But what about self-growth? That's why we say, come, let us help you. Let us
Yeah.
upskill you. Let us upgrade you.
Let us walk the journey with you.
You are a nurse already.
Let's get into this. So let's get into your the things that are on the table right now.
Yes.
I think we are deep into the podcast now,
Yes.
and people are wondering what is on
Product
the table,
manufactured
right?
by an RN.
Yes.
I'm so
By
proud
a
of
na-
you.
by a nurse.
By a nurse.
nurse.
Okay, by a nurse. You know why
These
she
are
said
products
you
made
know
by
why
a nurse.
she's emphasizing by a nurse?
Yeah.
It's because she told me that even a care worker
Mm.
can come to her training and be a manufacturer.
Wow.
Why not?
I mean, obviously.
We've got
Even
a lot
even a layperson.
Mm.
This is to say you've got a potential to grow.
Yes.
Depends on you how bad you want growth.
Mm-hmm.
Back to you.
Many people will think if I'm gonna manufacture stuff, right? You've got so many aesthetics, right? Body care, perfume range, tattoo removal, weight management, IV drip therapy, teeth whitening, lipolysis, and ultrasonic
Cavitation.
meditation, training, spa, brows, lashes, and when a nurse thinks business, they think let me do spa, or they think brows or teeth whitening. They think one specific thing, right? How do you get to this part? And also, you can tell me a little bit about these productions.
Why
these
not
products.
complement everything in-house?
Mm.
Comprehensive services.
Comprehensive.
Mm.
Remember, I'm doing scar management.
Mm.
So my tissue oil can assist you with that.
The tissue. That's tissue oil.
Yeah.
And I just want to shake cat with what sample just to show you how.
So I have been here. I'm gonna confess now that I've been sending people to buy tissue oil in spa.
How it works. I want to show you that.
No, yes, of course. That's why I'm saying. It's the glow. The glow.
How do nurses' hands look, by the way? How many times do we wash our hands?
Or we must stay on the mics. I've been seeing TikTok videos of people putting tissue oil on their faces, and all of a sudden, someone goes from "I just woke
Sister
up."
Ntombi, can I arrange that on that day, on the 8th of November? Sorry,
No,
Kate,
it's all-
if I
it's all
stopped
good,
you.
it's
I
all
felt,
good.
I
No,
behaved
don't
a
worry.
little bit rude.
Okay.
We need to come. I think let's arrange aesthetic. Practically, let's have people who wants to receive drip. Can you do
Elegance
that?
Aesthetics will be there with specialized prices for NBS.
Okay.
If you want to do your teeth whitening, will be there. If you want to prep your skin glow drips, will be there. If you want to purchase your voucher that you can use later, you are there.
Okay.
If you want to learn how to do your own skincare products,
Mm.
things will be there.
I need
Wow.
teeth whitening myself.
Yeah, you do.
I do.
You do. Don't
Can
do
I-
it. Don't
can I
do that
transfer
again.
this?
Yeah. No, you don't have to. You can tell me.
Can I transfer
we can,
this to
we can,
you?
I can be an ambassador. Call
I
me to
mean,
do it.
you
I want
are
to
a
remove my
brand.
gold.
Yeah.
This.
We have dentists that we affiliated with
Okay.
that
Oh.
can assist you with it.
Okay.
We did enhancement for
Mhm.
gold implants, but now we are doing teeth
That's
whitening.
a very
We're going
personal
natural.
thing.
No.
Say on camera.
Yeah.
We're going
Why?
natural
This-
now.
You're the
Yeah. No. I want to
We are
remove it.
transparent now.
personal.
No, we are
It's
transparent.
No.
transparent. No, for me to just go to a doctor somewhere,
Mm.
and I've got Sister Ntombi having that complete range in one house.
Right.
You know, she's not saying she's removing the
Yeah.
gold, but she's got doctors that she works with.
Okay.
And after that, I'm going for teeth
whitening.
whitening. Next time when I'm here,
That's the power of collaboration.
Jeez.
Yeah.
We don't compete, collaborate.
Yeah.
Diversified and unified.
Mm.
That is very important.
Yeah.
Definitely
Very
so.
good articulation of words. I feel like she can swallow me and
Oh my God.
That's the power of mentorship.
Yeah.
yeah.
Okay.
We don't only want nurses to open their own business,
Mm.
but we want them to be professional. We want them to be skilled.
Definitely.
We want them to be sustainable.
Mm.
Okay, opening a business is easy.
Mm.
It's a matter of purchasing and opening a door.
True.
But is the business profitable? Is the business sustainable?
Sustainable.
Is it scalable? Can it apply
Is
for
it
funding?
making money? Is it financially making money?
If you are non-compliant, you won't be fun. Shout out to Mr. Tebogo Mohudi, who is my business advisor at Cedar in Brest.
Okay.
Wow,
Nice.
nice.
You need Tebogo Mohudi.
Yes, we love you. NBS loves you. We're gonna
with
send
it-
all of our
you,
nurses
you
to
need
Tebo.
to have what you
Shout out,
call
bro.
brand identity.
Yeah.